Hello there. So today I'm going to talk about some instances where a general practice may refer your pet for a dental cleaning or dental procedure at a dental veterinary specialist rather than doing them in-house. There are some kind of very specific instances that some general practices may not be set up for. Your big ones are going to be one, stomatitis kitties. So stomatitis is a condition where the immune system essentially attacks the teeth, and typically resolution of this disease is taking out all or most of the teeth. Cat teeth, just to be blunt, kind of suck to take out. They like to fracture and turn into itty bitty pieces and just kind of disappear into the gums. So in some instances, GP clinics will actually send cats to the dentist for those to have a full mouth extraction to decrease their chances of leaving any roots of the teeth behind or having any issues that can worsen that stomatitis. Another instance would be if you have issues that need more, what would be closer to orthopedic surgery than actual dental surgery. So extreme jaw fractures, giant masses, if you need to remove part of the jaw with a mass, if you need to remove a huge section of gum with the mass, those usually go to the dental specialist. There are certain cysts or like super retained teeth that may need to go there if it's something way below the gum line that your typical GP practice will not have the equipment to do. One that I see sent off a lot that can frustrate some clients is we get a lot of smaller toy breed dogs that love to have horrible teeth, and it is actually a big issue with the potential for jaw fractures in these dogs when you're removing teeth, especially unfortunately when they come in, they're a little bit older, they have what we call trash mouth, where it's just nasty in there, and the bacteria associated with the dental disease has eaten through a lot of the jaw. There are certain teeth that are more likely to fracture the jaw than the others. One would be the canine teeth on the bottom jaw. There is not a lot of bone between the root of that tooth and the jaw itself, so it's very easy to fracture it taking those out. Another would be there's a very large tooth in the back of the mouth. On x-rays, you can actually see on a lot of these dogs there's almost no jawbone on the other side of the root of that tooth. So if it's removed, it can absolutely cause a fracture to that bottom jaw that has to be wired or whatnot. So just because a clinic is wanting to send your pet to a dental specialist, that doesn't mean that the clinic doesn't know what they're doing or just doesn't want to deal with it. There just are some instances that are more intense that need to be fixed on that type of level.